Gynecologist Jesse Shepard is joining us. Jessica, why is PCOS so commonly misdiagnosed?
So commonly misdiagnosed in women because, as you can tell, with all these symptoms, you really do have a myriad of other diseases that can cause all of those symptoms. So it really is putting the pieces of the puzzle together.
So Carol mentioned that her doctor blew her off.
Yeah.
What is the test that you would actually have your doctor do for you to figure out what's going on?
So PCOS is actually a criteria that we look at, and we look at three things specifically. So we want to see an increase in male hormones that are in the blood, and that's going to give you the oily skin and the acne and also the hair growth. So we do a blood test for that. And then the second thing is from the patient actually telling us, my cycles are really irregular, or I've missed a lot of them. So that's the other thing that we look for. And then the last thing that we look for are the ovaries, like you discussed over there on the table, showing the polycystic ovaries. We do an ultrasound and we look for a typical sign. And so of those three criteria, we lead at least two of those.
Come back here and show everybody what this ultrasound looks like. We brought an example. And this is actually, you won't forget this once you see it. Go ahead, Doc.
So if you see here, this is a beautiful picture, ultrasound of an ovary. So typically what you'll see all of these little dark circles, and those indicate follicles or eggs. And so typically you don't see a lot of these around the outside portion of the ovary. So when you see that, that indicates that there's increased eggs because of the increased hormones. And also we call it a string of pearl sign. So that's the string of pearls that you'll see.
Pearls you don't want.
Not in your ovaries, no. On your neck, yes.
All right. So once someone's found out through these tests that you mentioned that they have PCOS, what do you do about it? How hard is it to treat?
The good thing is that it can be managed and can be treated. And so for women who are not typically looking for fertility or to conceive, we want to, again, decrease that hormone in the blood. So we give them oral contraceptives or birth control pills because that decreases the male hormone in the blood. And it also regulates your cycle. So you'll find that people who have had really irregular cycles and sporadic cycles here and there, that really makes them regular. And that's great for the patient too. And so also obesity is a factor. 70% of women who have PCOS are obese. So losing 5 to 10% of your body weight can really reduce some of those symptoms.
So touch on that a little bit, because the foods that you eat are important in this process as well.
So foods are very important. I think diet is really important key to all of our health. And so specifically for PCOS, you really want to decrease any of those foods that are going to have high glycemic index. So high processed snacks, high processed carbs, anything with white flour, white sugar, and also some fruits that have a lot of high sugar, such as melons.
What do you think, Carol? Can you follow that advice?
Absolutely.
For all the two boxers out there, it's good advice for general health anyway. You can find the symptoms of PCOS on DrOz.com. If you have any of them, I urge you to speak with your doctor and push them a little bit. It's worth it.
How fast are new